It is Black Maternal Health Week, a time to highlight the racial disparities in healthcare and improve the birthing experience for women. The official theme this year centers around reproductive justice. And joining us now to talk about this is the CEO of Ancient Song, Porchia-Albert. Welcome.
Hi, thank you for having me.
Yes, well, talk about the unique challenges facing pregnant Black women.
Yes, so Black women in the United States are 3 to 4 times more likely to die of a childbirth-related complication or suffer a near miss. And so what we find is that we're in between this space where, racism and implicit bias is showing up in the birth room, right? Where we're going to have babies, we're thinking that this is going to be a joyous occasion, and then we find ourselves at the crossroads of many different things that are happening at once. So it's not just, racism that someone may be dealing with, but also not being seen and not being heard. We have a maternal health infrastructure right now that, doesn't have enough providers to be able to provide care. We have hospitals that are closing. We have, some states don't even have maternity care facilities for miles away. And so, we find ourselves in this space where we're just trying to give birth. We're trying to bring life into a world, a joyful occasion where you're met with so many different obstacles.
So what still needs to be done when it comes to postpartum care for Black women?
We need more maternal mental health services, right? And so, when someone is trying to, you just had a baby, right? It's a joyous occasion, you're trying to bond, and maybe you find yourself feeling overwhelmed, right? And you're telling someone this, but they're not necessarily responding to you. Or you're seeking out resources, but there's not enough. And so we really need to build up more Black therapists, right? We need more Black therapists. We need spaces where Black women and birthing people can go, to center themselves. Many different cultures have spaces where they, focus on like 30-day postpartum, 40-day postpartum. You're not doing anything. You're sitting, you're bonding. And so creating more institutions where folks can come for either group classes or independent one-on-one therapy, but also looking at like, where is a safe space for postpartum? Like, where can we go with our children where we can have those moments where we can bond and center ourselves and feel affirmed.
And what are some tips on how Black women can advocate for themselves when they're seeing their obstetrician?
Yeah, so first, always come prepared, right? So come with at least 3 questions. Think about what it is that you want for yourself. And a lot of times that can be daunting, right? Like, I don't know what I want. I know I want to have a healthy baby and a healthy pregnancy. But if you want to have a home birth, if you want to go to a birthing center, if you want to go to a hospital, ask questions centered around that, right? You want to make sure that when you are sitting there, that someone's answering your questions to a place where you feel like, okay, I feel comfortable with this. And then if you don't feel comfortable, then you can find another provider.
Exactly, that's not the right one for you, right?
Yeah, exactly.
Talk about your work and the resources that are provided.
So I run an organization called Ancient Song, and Ancient Song literally started in my home, and it came after me and my first child. So I have 6 children, and I had a wonderful home birth with a Black midwife and a doula, and it totally transformed my life. And from that experience, I went and took a doula training 7 weeks postpartum, and I started to take on births, and I was like, wow, okay. And so Ancient Song works as a training institute, and so we train individuals to provide full spectrum doula services. We also provide education and information, as well as advocacy. So we are, on a city, state, and federal level, we're working in reproductive policy to see more access to reproductive health care. As we are seeing things taken away, right? We really need to center a space where we're building up our maternal health care infrastructure. So we're doing that every day.
Chanel, thank you so much for being here.
Thank you for having me.